Hello, Life Vantage. This is Darren Jensen coming to you live from our, I guess this is our media center, our media studios here at our global headquarters in Salt Lake City, Utah. Today is a continuation of our doctor series. This is one of my favorite series that we have. It's really a chance for us to highlight some of our medical professionals that are part of our team and really get to know about them as well as their experience with the products. And also to share a lot of their wisdom and knowledge about products, nutrition, skincare, whatever the topic may be. So before we get on with today's guest, I should say. I said it plural. We only have one. But I say we only have one. We have an awesome one that's joining us. But today I just wanted to let you know that I'm also going to be giving away free product as we normally do. This is the Physique Pro Bio, and it is a wonderful product. This is one of the products that I use religiously every day. And the more that I listen to our doctors in this doctor series talk about your microbiome and the health of that, I am just convinced that this is a product we need to use every day. So I look forward to giving that away. What I need you to do, if you're interested in being part of that, is to put down your name, your city, and state, and we'll do a drawing for it a little bit in a couple of days. So even if you watch this later on, definitely put down your name, city, and state. I see that Sheree just put it down, and she's in Amsterdam, New York. I just had to check to see if there was a state on it because we are open in Amsterdam, the city in the Netherlands. So I see Karen, I see your name down, but I need your city and state. All right, so let's get into our doctor series today. Today we have Dr. Shaun McKee. Just a little bit about her if you're not familiar. She is a board-certified diagnostic radiologist and neuro-radiologist. She is the medical director and president of Coastal Imaging Associates, and she's the former chief of neuro-radiology at, I don't think I'm pronouncing this right, Keesler Medical Center. And she's from Biloxi, Mississippi. And what I thought was really interesting about her as I was reading her bio is she's a two-time Ironman triathlete and ultra marathoner. And she's also a mother of two teenagers. So with that, I'd like to welcome on Dr. Shaun McKee. Shaun, welcome. Glad to have you with us, Dr. McKee. All right, so I have got to ask you about this Ironman. What exactly is an Ironman so that everybody understands that?
It's a very, very long day. It starts out with a 2.4 mile swim, either in open water or in a lake, followed by a 112 mile bike. And then you finish up sometime in the afternoon with a 26.2 mile marathon. So it's 140.6 self-propelled miles. And it's a lot.
That is incredible. Now, okay, I can handle the bike ride. The bike ride I get through. I'm sure I could limp my way across after that. Maybe a marathon. Maybe if I walked it. But the how many miles of swimming?
2.4 miles.
Okay, I'd have to get in the pool because I must be swimming the wrong way. I'd have to have like a snorkel mask on and then I wouldn't make it. I think that would weed me right there. So congratulations, that's an incredible accomplishment. And what is an ultra marathoner?
They're anywhere from 30K to 50 miles and up to 100 miles. The ultramarathon that I did was 50 miler, and there was an option to change from 50 miles to 50K or 30K to 50 miles, and it was funny. All of the seasoned runners were giving me all of the advice, and it turns out it was a very, very hot day, and there were also controlled burns in the area. So all the seasoned people that were giving me advice switched to the 50K, and I just kind of slugged it out and decided I wasn't going to change my mind, and I did the 50 miles.
So it's for one of those times when one marathon just isn't enough, right? You got to We just gotta do too. I've never been in that position. I doubt that I ever will be in that position to where I'd want to run more than a marathon. But hey, congratulations! Those are huge accomplishments that I think very few people can say that they've done. So it's great to not only see a doctor who's going to talk to us about good health, but see one that is really walking the walk or running the run in this case. So anyway, thank you for joining us today and taking time out of your busy schedule. With that said, let's first, if you could tell us, how did somebody who's like here, former chief of neuroradiology, you're a medical director and president of Coastal Image Associates, how did you get involved in LifeVantage? What drew you to the company, to the products? Well,
it's actually a unique to this industry's story for me. About 6 years ago, as you might have guessed from my what we just talked about, I'm kind of like the Energizer Bunny. I'm always running and going and energetic. And there came a point in my life 6 years ago that I kind of was just really exhausted, and I really couldn't put my finger on it. I would basically fall asleep on the couch while my husband was telling me about his day. I would fall asleep within the first 5 minutes of any movie that my family went to. And furthermore, my sweet husband would come into the bedroom in the morning with a cup of coffee, putting it on the nightstand, hoping that might, get myself moving. So I went to see a doctor that kind of specialized in, giving women hormones and whatnot. My husband actually did the recommendation, and I thought maybe I was low in a number of things. And turned out, my suspicions were correct, and she put me on a number of supplements, and I took them for 6 months, 28 pills a day, and I hated it. I went back to see her, and that's when she told me, well, there's one product that's clinically proven to reduce oxidative stress 40% on average in everyone who takes it, and they have peer-reviewed research on the product. So my husband and I both take it. Now, her husband is an elite Ironman triathlete, so I perked right up, and I made sure that I was on it. The next day, I ordered it, or that night I ordered it, and I've been, force feeding it to my husband and everyone in the family since then. No, he takes it on his own now.
Wow, 28 pills a day. You almost sound like me, because I take all of the LifeVantage products, and if I had to go get one of those big, supplement pill cases, because, by the time I get all of the physiques and, all of the activated essentials and everything in there, it takes up a lot of space, but not quite 28 for sure. Why are the LifeVantage products such a game changer to you? I mean, tell me what you think are the key products to be taking, and why are these game changers?
Well, for me, I was really, really looking for that unifying theory of all of the things that I had been told to take by my doctor and had sought out on my own. I was looking for something that was anti-inflammatory, antioxidant, just something to kind of help optimize my body. And when my doctor told me about Protandim Nerve 2, I was literally, so happy, because it was like a eureka moment. I'd finally found the one thing that would kind of address all of the downstream things that go wrong with the body when it's, getting into the middle age or just run down. So the reason it was a game changer for me is it was absolutely it addressed the upstream cause of everything that goes wrong, after age 20.
Okay. Just trying to get me back onto the screen here. All right. So you said the game changer was it addressed the upstream, causes. What are some of those upstream causes that were important to you? I mean,
well, cellular oxidative stress is a huge unifying theory of basically aging, and the underlying cause of why the body starts to malfunction with age. In fact, it's linked to hundreds of diseases. And when I learned that there was something that literally lowered that by 40% on average in 30 days, I was amazed, because, things like direct antioxidants, which I was taking gobs of, they'll address it a little bit, and a kind of a breakthrough or significant reduction is something like 5 to 10%. So when I heard 40% reduction, and that really means taking, your oxidative stress levels back to what a healthy teenager or 20-year-old or even a healthy child would have. And if you think back to when you were a child, and you kind of compare your laundry list of what things are bothering you in your 30s, 40s, 50s, and upward, little nagging things, aches, difficulty sleeping, brain fog, whatever, you probably didn't have those things when you were a healthy child. And that is because oxidative stress is that factor that damages cells and damages lipids and damages even your DNA. So just having that address what I knew was going to be huge. Didn't expect to feel anything. You don't feel oxidative stress any more than you feel your cholesterol level or, God forbid, cancer cells dividing. You just don't feel those cellular processes. But they do have an impact on your health and how you face your day.
All right. Well, thank you. For those that are joining us live, if you have questions for Dr. McKee, if you could just write those in the live comments section. I'm keeping an eye on those right now and just posting comments as they come through. So if you have a question just pose the question there. If it pertains to what we're talking about, I'll make sure and pass it on to Dr. McKee. Also, just a reminder for all those that would like to be part of the drawing for the ProBio, make sure you put down your name, your city, and your state, and we'll get you into the drawing in the next few days for that. All right, Dr. McKee, being a medical professional, what impact did the peer-reviewed studies have for you in your process of taking the products as well as becoming involved with the company?
It was huge. It was huge. First of all, any supplement that I had been taking previously did not have peer-reviewed research. I can guarantee it. There might have been some research done by the doctor that the company hired to say I approve this product, or our research shows. But there's a difference between a company's paid-for research and real peer-reviewed research that is published in peer-reviewed journals. That's the top tier of medical research. I'd say probably 5% of medical literature is actually published on the National Institute of Health website for the National Library of Medicine, which is pubmed.gov. And when I first found out about this, that's where I went. I went to pubmed.gov. It's where researchers go. It's where doctors go. And I just typed in the brand name, Protandim. And I was amazed. There were 9 studies at that time. 9 studies showing that, one, it reduced oxidative stress, just like my doctor said, by an average of 40% in 30 days. And then tissue studies and animal studies based, looking at what it does for certain tissues. And I just found that was really remarkable because, if you look up Geritol, protein shake by whatever GNC cells, you're not going to find peer-reviewed published studies showing any benefit. If you do find peer-reviewed studies, there may be ones showing that there's actually harm. So that meant a lot to me.
All right, Dr. McKee, I'm keeping an eye on the live comments here, and there's a question that's come through a few times about ProBio, and that may be just because we're offering again the ProBio. Oh, so I've got to get the thing around there, the ProBio. They're saying what on it and can comment. What do you know about ProBio and what sets it apart from?
Oh, I'm glad you asked that, because actually that was one of the 28 pills I was taking, and I've taken probiotics for a long time, years, seven years plus, and I have never known they were working. I've never felt the effects of them. I just knew, they're good. The gut microbiome is basically a 4-pound organ in our body, and we're 99% bacterial or microbial DNA between the fungi, viruses, and bacteria in our intestine. That makes up 99% of the DNA that is in our bodies. We're 1% human DNA. So that should tell you what a huge impact your gut microbiome has on you. And a healthy gut microbiome actually makes glutathione, and glutathione is a master antioxidant. It detoxifies, repairs, it's a chelator, it's responsible for phase 1 and phase 2 liver detoxification. Your gut microbiome also makes neurotransmitters, and it also determines whether you store fat or burn fat. I mean, it's absolutely incredible what your gut microbiome is responsible for. Now, that being said, I never could tell, like I said, that what the probiotic that I was taking was having any effect. And I was kind of a little bit dismayed at, when I was taking one that had 80 billion colony forming units, and then I found there was one that had 130 billion colony forming units, and I would change to that one, and it was kind of like a CFU war. They all had, ours has more colony forming units. Well, it's not how many that are in the bottle that counts. It's not even how many that are alive in the bottle that counts, although that's important. What matters is how many are alive when they get to your intestines, your small and large intestine. That's where they have the effect. The problem with most probiotics on the market, and the ones that I was taking, and I'm talking like 95% probably of the probiotics on the market, is that they are exposed to air, whether they're liquid, powder, capsule, whether they're refrigerated or not, whether they're freeze-dried or not, they're exposed to air. And air kills the microbes. They're very delicate. The other problem is as soon as you swallow them, they come into contact, where most of them, unless they're sheltered by food, come into contact with the harsh acidic environment of your stomach, which kills them. So of those 130 billion colony forming units, only 4, maybe 6% are making it to your large intestine. What I found remarkable about the ProBio that LifeVantage came out with is it's literally vacuum sealed. It's an interesting patented delivery system that is vacuum sealed, and the coating is actually impervious to the stomach acid, and it does not release the microbes until it's in the alkaline environment of the small intestine. And what's really interesting is it's a layered probiotic, so that the microbes that are better suited to the environment of the small intestine and do their work there are released first, and the ones that are better suited towards the lower end of the intestinal tract, the colon and rectum, are released last. So it's an incredible probiotic, and actually has another effect. If that wasn't good enough, I don't know who thought of this, but LifeVantage had the forethought to add another patented product called Wellmune to it. And Wellmune is a beta-glucan, it's a prebiotic, and it also affects how your white blood cells bind to complement and how they respond to an attack and keep you healthy and improve your immune system. And that product, that actual Wellmune, has been shown to, has a lot of scientific literature, peer-reviewed published studies showing it diminishes the occurrence and duration of colds and flu. So I think it's just it's a beautiful product, and I will tell you that I know it's working. It has changed. It changed my my gut for the better.
I know with you, I'm not a big user of probiotics. I'm getting a little bit, but I have become absolutely dedicated to taking them every day. And while you were talking, I was posting up some little links here for Wellmune, as well as the BioTrack technology. These bacteria get to where they need to go. Like you're saying, that's so important, because if not, they're destroyed, and then it's no good. Apart from the ProBio, I know that we've been bundling together. There are essentials. So we have the ProBio, we have the Nerf 1 and Nerf 2. Can you take a little bit of time and talk about the power of that bundling and the 3 products that we have together?
I would love to. I'd first like to explain what Nerf 1 is. And I forgot to mention, rewinding just a little bit about the probiotic, when I was talking about how it's protected, it's about 60 to 70% of the colony forming units in the actual bottle, in the caplet, and the capsule, make it to the colon, to the final part of the large intestine. So that's a 15-fold increase in bioavailability. So that's huge. The Nerf 1 is Protein and Nerf 2, the little yellow pills, companion product, and I absolutely love it, because one of the things that oxidative stress does is it damages the mitochondria. And the reason for that is they are where the energy, 95% of the energy is produced by oxidative phosphorylation in the mitochondria. So you can think of the mitochondria as engines, machines in the factory, and they're pumping out energy, and they're basically doing it and producing all of the free radicals, or the heat from the fire, so to speak. And those free radicals are produced right where the energy is being made, and that damages the very engine that's producing the energy. So when I mentioned earlier that oxidative stress is linked to the underlying cause of aging, or a large part of it, and linked to hundreds of diseases, one of the main reasons for that is mitochondrial damage. So in effect, mitochondrial dysfunction is linked to aging and hundreds of diseases. So those two products together, just the NRF2 and the NRF1, address cellular stress, decreasing it significantly, and address cellular energetics, or energy, increasing it significantly. And then you add in the gut microbiome improvement with ProBio, you literally have the three pillars of the three legs of the stool for optimal cellular health and cellular energy and gut health. And I just think it's absolutely phenomenal that LifeVantage has bundled them together. And not only are you saving $9 on the three products, which is significant. It's, I don't know what the percentage is, 7 or 8%. You also give people free shipping with that, and shipping is very expensive these days. I sold something on eBay the other day, and it was like 1.4 pounds, and it was like $9 to ship. I was amazed. So getting free shipping is an incredible deal. And the three products together, I believe we all need to be taking all three of them every single month. My whole family takes them, and we're saving significantly on the cost of the bundle itself, and then the free shipping is icing on the cake.
All right, thank you. Everyone, that if you have questions for Dr. McKee, to pose those to along the side. Pose a question into the live comments for all those watching. If you currently take the Activate Essentials, which are the three products, the ProBio, the NRF1, NRF2, why don't you put up a number 1? And if you're only taking, if you're not taking those and maybe just taking one product, like maybe the NRF2 or something, put a number 2. I just want to get an idea of how many people are taking advantage of the free shipping as well as the bundling option for the Activated Essentials. So let's see. I see a few starting to comment. So far, they're all 1. Congratulations. I see they put up a bunch of 1s. Can you see what they're putting up,
yeah.
Doctor? Okay. A lot of 1s. I see 1, 2 out there, and other just a couple of 2s. So it looks like the vast majority are using all 3, which is great. So, Dr. McKee, with using the bundling, what a bundle our skincare together, give that some free shipping, and what about this NRF2 technology that we have built in to our True Science products? Can you talk a little bit about True Science and the importance in this product line?
I will tell you, True Science has just been such a boon to me personally, because a little story, when I was in my mid-30s, and I'm 51 now, my hairdresser would just get so frustrated with me because I don't typically wear makeup. And so he actually, thinking he was being nice, said to me, at age 35, well, you should at least consider tinted moisturizer. And I was like, no. And then he said it like 3 or 4 times, and he sold some at his shop. And I was kind of like, you know what? I'm going to get a new hairdresser that doesn't talk about my blotchy skin. So I was so excited when we basically decided that as a company, and that was before I was here, that while your skin is your largest organ, it's certainly affected by oxidative stress as well. And in fact, it has 2 sides. So your skin can be nourished from the inside through the bloodstream and the dermis with NRF2 activation, but all the while it's being attacked and pummeled by fumes and fluoride and chlorine in the water that we either swim in or shower or bathe in, sun rays, pollution from the environment, x-rays. I'm a radiologist, so it's being attacked from the outside. And the fact that the company made a Nerf2 activator for the skin is game changing. In fact, now the company has actually put out a whole, they used to call it an anti-aging system, but now it's a beauty system. I love it because the cleanser smells amazing, first of all, feels great, doesn't strip the oils from my skin, and I use it as a shampoo. So, I don't have to worry about thinning hair, because when you have healthy hair follicles, lowered oxidative stress helps with health of the hair follicles. That will help preserve, the beauty of my hair, hopefully. But that's the first part that they came up with. They came up with a combined.
Just a quick question on that, Dr. McKee. So you use the cleanser as a shampoo? First time I've heard somebody say that.
I do, and I have several dermatologists that are on my team, and they literally recommend it for their patients with thinning hair. They recommend that they use the shampoo the cleanser as a shampoo, and the number 2, which is a perfecting lotion, a combined hybrid serum and toner for kind of a conditioner to leave-in, almost like just a leave-in product. And I love the perfecting lotion because I'll tell you, one of the reasons my hairdresser was saying all that is I've never been a regimen person. I've never even used moisturizer. I simply wash my face in the shower with Dove soap. So don't use that as a screenshot, by the way. So the perfecting lotion takes out one of the steps. I don't have to do a serum and a toner. I just use the perfecting lotion. And then the eye serum actually can be put on top of the lids. And I've had friends that have scheduled eyelid surgery, and they started using that eye serum on their eyelids and under their eyes, and they literally canceled their blepharoplasty because their skin tightened up. The anti-aging cream I use all over my face, my neck, my décolleté. I use it on my hands. Every time I put my anti-aging cream, I do this, and people tell me my hands are, very, very smooth, and I agree. So I just love the skincare. Love it.
Well, you've given me some good ideas there. My wife, she's always hair is thinning, and I'll have to tell her your combination. You'll have to write it down and send it to me so that I can have her copy it. Have you noticed an improvement in your hair?
Oh yeah, I definitely have it. In fact, sometimes I've traveled and forgotten shampoo. Well, before I was using the cleanser routinely as a shampoo, I had forgotten shampoo and conditioner, and I used the number 1, the cleanser, as shampoo, and I used number 4, the anti-aging cream, as a conditioner, and it worked so well. I was amazed. Now, I typically don't use the number 4 as a conditioner because I have some good conditioner that I like, but I do sometimes put it in my hair if I've got too much on my hands. And now, oh, by the way, the combination of the Nerf2 internally and the Nerf2 topically using the True Science Beauty System, the other day, and I love this, and it's, please forgive me, but I have to say it's because it's true. What the lady said, I saw a lady who's an herbalist in my hometown. I went to a doctor presentation on, I forget what it was on, vitamins or something, in the local library, and she had not seen me in 5 years, and she literally emailed me later and said, "You look 10 years younger than you did 5 years ago." And I was like, "Yay, Nerf2."
That's wonderful. Thank you for hearing your well, with that, our time, but Dr. McKee, thank you for your time and for taking time out of the day and your busy schedule to be with us. Maybe as a final thing, if you could just maybe, I don't know, if you have any final thoughts, final words of wisdom about anything out there, what would you, eventually we'll probably have 30 or 40,000 people watch this video. Don't mean to put you on the spot with that, but what would you tell them? Why should they use the product? I mean, coming from a physician, why use this product?
Well, I think that the whole world is moving towards taking personal responsibility for their health. And there are a number of reasons for that, and I'm not going to get into that. But and so what it is resulting in is people are looking. They're looking for something they can take that will help their body kind of turn back the hands of time, or just heal faster, or recover better, or have more muscle synthesis. And I just think that the vast majority of products, well, I know that the vast majority of products on the market do not have science that you can actually, put your, depend on. And the fact that we have something that addresses these issues in a far more sophisticated manner, biohacking essentially your genome and the aging code, it just seems silly not to take advantage of it, especially since it's, not expensive.
I agree. Well, thank you, Dr. McKee. Thank you for spending time with us today, sharing your wisdom. And I love those suggestions on the true science. I'm going to have to tell my wife about them this evening when I get home. So anyway, if you could stay here with us for just a second, I want to talk to you after we end the broadcast. But again, to everyone watching us, if you're joining us, remember, if you want to be in the drawing for the Physique Pro Bio, just put down your name, city. And thank you for joining us. We've got another presentation tomorrow with our leadership series, and that's going to be with Michelle Scaff. So we'll see you tomorrow, and thanks for joining us today. Bye.